I apologize right off the top. I've got some laryngitis, so my voice is kind of wonky, but hopefully you'll be able to hear me. Anyways, thank you for coming out this morning, kind of a blustery morning, for a discussion about the Johnson Shoyama Graduate School's latest policy paper, which is being issued today on the legalization of cannabis and the policy implications that that presents, which are really quite significant. So I think that we could have a very interesting discussion as the morning unfolds. The four authors are with us today, sitting next to me to discuss the report. To my left is Kathleen McNutt, the Executive Director of the Johnson Shoyama Graduate School, Cynthia Borkowski, Jason Childs, and George Hartner, and I'll introduce them a little bit more with their bios as we progress. My name's Dale Eisler. I'm a Senior Policy Fellow here at the Johnson Shoyama School, and I'll be the moderator for our discussion. I don't think Tina Beaudry-Meller is here, although she had registered to come. Okay, good. Fine. And Tina, of course, is the MLA for Regina University and also a candidate in the Saskatchewan Party leadership. And I also want to mention Richard Barassa, Chief of Police for the City of Moose Jaw. Hello, Richard. He's going to keep order here. Anybody steps out of line. So thanks for coming, Richard. Just very briefly, the Johnson Shoyama Graduate School is a provincial center for the advanced study of research in public policy and administration. And the school is really quite unique in that it's a partnership between the University of Regina and the University of Saskatchewan. And we are located on both campuses. And so it's a great example, I think, of collaboration between the two universities and really quite a unique venture. And actually, we celebrated the 10th anniversary of the school last Thursday with a bit of a gala dinner in Saskatoon. And I want to, I don't think we can see them on the screen right now, but welcome our colleagues in Saskatoon who are going to be video linked in when we get into the Q&A session. And I believe Erica Schindel in Saskatoon is there, and she'll kind of moderate the questions as they come out of Saskatoon. So very briefly, to put our discussion in context, the Cannabis Act, which is Bill C-45, comes into force in July of next year, July of 2018. And it is going to permit the legal production, distribution, and sale of cannabis for recreational purposes in Canada. And with it will come far-reaching economic and social implications for policymakers, all policymakers, right across the country. So this is a really sort of challenging policy issue for all governments, and why we're here today. And if I could, just as an aside, I remember, now I'm sort of demonstrating my age, but being a university student here, and I think it was 1969, when the Ledane Royal Commission on the Non-Medical Use of Drugs was going across Canada doing public consultations on decriminalizing potentially cannabis, marijuana in those days, among other things. So this has been on the public agenda for a very long time. And faced with the scope of issues that this new law presents, the Johnson Shoyama School, the report examines the policy challenges. And the authors will discuss the report and answer some questions. So again, just to let me introduce the authors. Kathy McNutt is Executive Director of the Johnson Shoyama School. She's a full professor at the University of Regina and an adjunct professor at the University of Saskatchewan. Kathleen has more than 30 scholarly peer-reviewed publications, a variety of academic chapters and public reports, and has presented her reports, her study and research throughout Canada and Europe. Her main research interests include complex policy issues using advanced policy analysis and techniques. Next to Kathleen is Cynthia Borkowski. Cynthia is a second-year doctoral student at the Johnson Shoyama School here at the University of Regina. She is interested in health and social policy and applies this knowledge by contributing to research and participating in course instruction. Cynthia obtained a Bachelor of Science in Occupational Therapy from the University of Alberta and a Master's of Science in Occupational Therapy from Dalhousie University. Next to Cynthia is Jason Childs. He's an Associate Professor of Economics at the University of Regina. And interestingly, one of Jason's areas of focus and study, and in fact teaching, is the economics of beer, which is something we're all very interested in. Specifically, the ability of pricing to manage consumption. How do these things two intersect? And I think that this is obviously sort of that kind of approach is very relevant in terms of cannabis. And Jason has produced work published in a wide variety of academic outlets, including the Journal of Public Economics, the Review of International Economics, Computational Economics, and it goes on. So Jason has done a lot of research in the economics field. And at the far end is George Hartner. George is a lecturer in the Department of Economics at the University of Regina, with particular academic focus in financial economics and economic evaluation. George also has extensive professional experience in the areas of public policy development, program evaluation, and strategic, operational, and financial management. So he sort of brings an academic and practitioner's approach to issues, which is obviously very helpful. So with that, maybe I'll turn it over to Kathy, and I think she's got some slides that she's going to run through to kind of contextualize this discussion, and we'll go forward from there.
Good morning, everybody. Thank you for being here. I see lots of friends in the audience, so that's great. By July 2018, the illicit market for cannabis is going to be legal. Cannabis has been illegal in the country since 1923, so this is going to be a massive sea change in terms of taking an illicit market and moving it into the formal economy. And the implications for this and the opportunities are both going to be significant. Now, while some provinces and professional associations have understandably requested more time to prepare for the Act, coming into force, the federal government has very little appetite for actually providing this room. And the underlying logic is that any delay wouldn't mean another year of cannabis, illicit cannabis in the hands of children, and another year of police fighting a losing battle with the illicit market. So really, when we did this report, we wanted to look at it. It's a very interesting sector because there's no public policy on it. Because it's been illegal for so long, we got to take the entire kind of framework of public policy and look at all the different aspects, which is probably something that's never going to happen again in our careers. So for us, it was fairly exciting to be able to piece together all these different types of evidence. So what we did was we looked at public safety, we examined public health, we did an economic analysis, we had a comparative analysis because some of the states in America have legalized cannabis. And then we did an examination of innovation and what that potentially might look at. And I want to point out that one of the things we quickly learned and through a lot of the debates that we had, these lenses are often competing. So what might be great for the public health lens is not necessarily the best for public safety. So it's really about balancing everything we do in a public policy context to ensure that we mitigate risks and we ensure that children are protected and that the least harm is occurring. So the current cannabis context in Canada, cannabis is the most commonly used illicit drug in Canada, and there are countless hours spent by police trying to fight the cannabis market. Right now you'll see in Regina and Saskatchewan, but right across the province, a number of illicit dispensaries popping up, selling recreational cannabis. And this is at a time when, if you think about the effects of the opioid crisis and the effects of meth spreading across the country like a cancer, police are spending countless hours trying to fight the illicit cannabis market. So one of the biggest problems that we face, though, is that young Canadians are the most common users. And young Canadians are also the ones that are most vulnerable to the harms of cannabis. So during childhood development and really right up until about 21, sometimes into 25, children can have an effect of cannabis. But the problem is that the biggest user market today in Canada is 18 to 24. And the second largest use is between 12 to 17. So this is an issue. These are the folks that are the most vulnerable. So in terms of opinion polls, Saskatchewan people generally support the legalization of cannabis. There's been all kinds of different opinion polls, and all opinion polls should be taken with a grain of salt. But the general trend is that we are fairly supportive in Saskatchewan. What we're worried about is how it all goes down. So what it's going to look like, what the regulation is going to look like. And of all the provinces and territories in terms of actual usage, we're about 6th, so we're kind of in the middle of the pack in terms of how many people are actually using cannabis. So the federal government's decision to legalize is based on 3 explicit federal objectives. And the first one is to dismantle the illicit market. As I suggested, there's countless hours of policing resources being used to combat illicit cannabis markets. The second is to restrict youth access because, again, youth and young people are the most vulnerable to the harmful effects of cannabis. And finally, minimizing harm. And this is really meant to consider the health risks for the public and how to best incentivize using cannabis in a way that avoids those risks. Now, beyond these stated objectives, there are also some economic incentives and there's some pretty major potential for tax revenue. And I'm going to hand it over to George now, who's going to speak to this. But just for context, illegally, British Columbia, who has the largest industry of all the provinces, with sales are estimated to be approximately $443 million annually. So I just want to wrap your heads around how much actual money that is in the illicit market, untaxed, and not currently supporting any sort of programming. So I will turn it over to George.
Yes. So with legalization of cannabis, there's the potential to bring a significant amount of underground economic activity into the formal economy. For Saskatchewan, we've estimated demand at about 25 million grams a year. So based on that and roughly a $10 kind of average price per gram, we should see 250 million in economic activity. And that's just the direct benefits. That's not counting all the indirect benefits and the so-called multiplier benefits from there. So the Saskatchewan government should be in a position to see about 25 million in tax revenue.
Okay, well, we know that people are going to use cannabis, so let's make it as safe as possible. Moving away from an illicit market allows for the establishment of a safe and regulated supply chain where consumers know what they are purchasing. In fact, packaging can actually be identified with the potency, risks, and the quality of the product that they're buying. We also want to take measures to protect our youth and encourage responsible adult usage. Restricting public use and making careful decisions about where and how cannabis will be retailed will help minimize public safety concerns. For example, preventing youth access as much as possible should be our goal. So if we set up retail outlets that are removed from schools and youth centers and avoid high-risk neighborhoods, that will help minimize the harm. Also, anyone who sells to minors should be subject to strict penalties. Additionally, Saskatchewan employers should utilize this time prior to legalization to review their policies pertaining to impairment in the workplace and any kind of cannabis and workplace safety issues that may arise in their locations. It is also recommended that the potential for drug-impaired driving be taken very seriously. In 2016, Stats Canada released a report that Saskatchewan has the highest rate of alcohol-impaired driving out of all the provinces in the country. And we know that when cannabis and alcohol are mixed, the rate of impairment significantly increases, and so does the rate of causing a car accident. So we need to do what we can to reduce the amount of drug-impaired driving that's going to happen. Unfortunately, many of our police forces across the country are currently under-resourced to deal with drug-impaired driving, and in fact to deal with some of the public safety issues that will arise from the legalization of cannabis. So we would recommend that some of the revenue that occurs from the cannabis industry be reinvested into police education, training, and resources. Minimizing harm associated with cannabis use does not only apply to public safety, but also to public health. The phrase, "this is not your parents' pot," or actually, "this is not your grandparents' pot," depending who we're talking to, actually makes a lot of sense. Sometime around the early 1990s, cannabis strains were modified and the THC potency levels were changed. Around the early 1990s, potency levels were around 3%, and now cannabis strains are testing on average between 12 and 15% of THC potency. And then there are actually additional products like cannabis oils and edibles that are testing at potency levels of 70% or higher. Cannabis has been associated with poor health outcomes physically, cognitively, and mentally. For example, new research is linking cannabis to heart attack, stroke, and certain types of cancers, especially in middle age and older users. Chronic users often experience problems with memory, attention, and problem solving, and stopping the use of cannabis doesn't necessarily allow for those cognitive abilities to rebound. And mental health is definitely at risk with cannabis use, especially for those who have a predisposition to mental illness. And despite what people think, cannabis can be addictive. The main reason why we need to do everything we can to minimize adolescent use of cannabis is because their teenage brains are very susceptible to THC and other components of cannabis. There's a certain type of receptor in the brain that hits its peak during adolescence that absorbs the THC or uses the THC. And in fact, it's at such a high peak during adolescence that sometime around early adulthood, the number of those receptors in the brain actually deplete by about half. So this means that the difference between the adult brain and the adolescent brain is that adolescents are can be very subject to the negative health outcomes of cannabis, including mental illness and addictions. Delaying the age of initial use is one way to minimize harm associated with cannabis. We also need to consider cannabis use in pregnancy. Like the adolescent brain, the in utero developing brain is also highly sensitive to THC. Babies who are exposed to cannabis in utero are at risk of long-term developmental delays. Many times these developmental delays don't become obvious until somewhere around the preschool or kindergarten years, but as their academic careers continue and the demands get harder, these children grow up to have greater and greater challenges. What is especially alarming about this is the recent trend that's been seen in Colorado, where pregnant women have been using cannabis to combat nausea associated with pregnancy. And the research on the cannabis affecting the nausea is pretty on the fence as to whether it works or not, but the research that looks at how this is going to affect the unborn child is not on the fence. Cannabis should not be used during pregnancy. It is very likely that our health, education, and social services sectors are going to see an increased demand for their services as a result of this legalization. By reinvesting a good portion of the cannabis industry revenue into programs and policies that support the citizens of Saskatchewan, we can mitigate some of the long-term negative outcomes. Furthermore, a large-scale educational campaign to inform people about the risks that cannabis poses could be very important in helping people make good decisions about their own health. Fortunately, we were not starting from square one with developing policies and procedures to support regulation and enforcement in the cannabis industry. We were able to use information from Colorado, Washington, and Oregon to make suggestions for smart practices and hopefully avoid some of the challenges and pitfalls that these jurisdictions have faced. A thorough review of what's worked in those locations, as well as looking at policies that other provinces have already suggested or put forth, has allowed us to apply this helpful information to Saskatchewan's context.
So when we're talking about the government of Saskatchewan, how should we respond? Of all the policy instruments available, information is going to be the most important. Information and public education. And as we shift towards legalized cannabis, we're going to need numerous information campaigns. They're going to have to be focused on prevention, focused on awareness, looking at different forms of health prevention and treatment. These are going to have to be targeted campaigns in many cases towards youth and parents, and in particular vulnerable populations. We're going to have to educate the public on the new laws and the various aspects of the legalization of adult use cannabis, including outlining legal possession limits, household cultivation, consumption levels, and changes to the criminal code. We're also going to have to enhance health literacy and health promotion for expecting mothers and vulnerable populations, as Cynthia's just been speaking to. And it's also important to have information available because there's going to be misuse. So it doesn't matter what we're talking about in terms of an illicit substance, they're going to be misused, so we should be ready for that. Next, we're going to have to regulate. Extensive regulation will be required with everything from product safety to licensing to age limits. I also think that it's important when we're talking about dismantling the illicit market to understand that really what we're asking police to do is to mitigate. The illicit market is massive. And the idea that we're going to suddenly get rid of this overnight is not realistic. I mean, consider how long it took to stop bootlegging, right? Just that alone, if you just consider that, it's still going on in some areas of the country. So we need to be prepared to measure policing success incrementally as the transition from the illicit market to the formal economy occurs. Finally, there's a lot of opportunity to innovate. At the end of the day, cannabis is a plant and we are an agricultural province. If you consider our sophistication in things like plant breeding and our knowledge of organic farming and our capacity to use inventory control systems around that, we have a lot to offer. So I think that there's a lot of things that we could potentially gain. And I'm not even touching here on things like the hemp sector or edibles or the craft market. So while we definitely need to educate, we need to regulate, we need to understand that it's going to be mitigation, there are also opportunities for innovation. And I think Saskatchewan is well situated to look at some of these and become a leader in the innovation file.
Thanks, sir. So, like I said, we're estimating the demand in Saskatchewan to be at about 25 million grams per year, and that's a range of 20 to 40 million, and the range is large, but the data is difficult to come by. As said, there's mostly coming from surveys and self-reporting. With respect to the supply, it's very likely, most likely, that we're going to see a severe shortage of cannabis upon legalization. Legal producers are nowhere close to being able to meet the demand for cannabis. Now, just to kind of recap on that, the economic benefits that we talk about are the degree to which Saskatchewan's able to capitalize on those economic benefits is based on how well we can compete with the illicit market and how much of the value chain in cannabis we can capture.
So based on that, we were making some recommendations on how to structure the retail market, and it's really important that this be done properly, again, with the objective of eliminating the illicit market. So the legal market has to be on a footing to compete effectively and win against the current existing illicit market. So on that, we've got to make sure that we align market forces with the regulatory structure we're putting in place to give it that chance to win. So we're recommending the granting of a limited number of retail licenses that are going to be geographically specific. It's going to mirror to some degree the licensing structure used by SLGA for liquor stores right now in the province, with the idea of limiting the number of outlets, but also providing sufficient outlets in the right locations to compete with that illicit market and to minimize the harms of proximity. So one of the things that comes out of some of the other jurisdictions in which cannabis is legal or pseudo-legal, the closer someone is, their home is to an outlet, the earlier they start consuming. So we want to try and manage that effect. We want to recommend that cannabis retailers are standalone, so they're not selling tobacco or alcohol as well. Particularly with alcohol, the joint use effects are too pronounced to ignore. We want to enact zoning requirements. This will be done at the municipal or local level to keep the outlets away from schools or other places where children are going to congregate or youth are going to congregate. We don't want to be having that situation where there's accidental exposure of children to advertising for cannabis, even if it's subtle or restricted. They want to develop a merit-based system for deciding who's going to get to run a retail outlet. We've got to make sure that the people running these outlets have the required knowledge, skills, and commitment to not selling to youth and does that social commitment to their community. We've got to make sure that's done properly. We want to expand the mandate of SLGA to be the regulator. SLGA has some wonderful expertise and skills in regulating the cannabis market, and we want them to, or in liquor market, excuse me, I misspoke there. We want to expand that so that they can apply those skills to cannabis. We're going to allow retailers to use prices to balance the supply and demand. Because remember, it's not just the legal market we have to worry about. There's an incredibly flexible, well-entrenched illicit market that is going to be competing. And if we set overly rigorous minimum prices or very aggressive taxation, we're not going to allow the legal market the chance to compete and displace that illicit market. And if that doesn't happen, none of the other benefits are likely to flow. Okay, next slide. So a distributor, and this is where we're agreeing and disagreeing with some of our other provincial recommendations that have come out in other jurisdictions. Ontario, Quebec, New Brunswick have all announced roughly what they're going to do. So we want to establish a single distributor for all cannabis products coming into or moving out to the retail sector in the province. So we want to place one distributor. Again, that's going to be for control and quality and eliminating illegal producers from the market. We want to mandate that this producer test all product coming through for potency and purity. Right? We've already seen some of the legal producers for the medical market having troubles with recall. And some of the products have been contaminated, and we want to make sure that we avoid that. If we're going to provide a safe product, we have to be serious about it. We want to establish a governing board for the distributor that's going to take stakeholder information and ideas from all over the place and citizens and every interested group and be able to work with the distributor to implement new policy and keep it evolving going forward. Nobody is going to get this right immediately. This is going to have to evolve as the market changes and adapts and grows, and as the illicit market reduces in size and importance, the game is going to have to change. And the distributor and the regulator have to be responsive to that change. Right? We want the distributor to work with Health Canada and other regulatory agencies to reduce the barriers to entry for Saskatchewan producers. Right now, the regulatory process, the licensing process to become a producer is quite onerous, and it's quite involved, and it's slow. So we want to have the distributor work with Health Canada and producers to get more local production involved. Right now, there's a serious risk of the production market collapsing to a very small number of firms. We're seeing motion in that direction already with bids for one firm taking over another. We're likely to see consolidation similar to what we saw in the market for beer, where you ended up with only 2 major producers. We want to avoid that, okay? And we want to empower the producer to import and export. It's highly likely that we're going to see a shortage of legally produced cannabis in Saskatchewan after legalization. Legal stores with empty shelves don't displace the illicit market. So we need a distributor who's going to be in a position to import and import quickly, but also to guarantee the safety and quality of that product that is imported. And once the market gets established and producers get established, it's also possible that we're going to be in a position to export. And we want the producer to be able to facilitate that export industry. The last recommendation we're going to make in terms of this structure is taxes are going to have to start out low, because you have an untaxed segment of the market right now. These people are not paying any taxes. They're not meeting any sort of occupational health and safety standards. They're not meeting any sort of minimum wage standards. They're highly able to compete on price. So we have to ensure that the legal market is also able to compete reasonably well on price in order to displace that illicit market. Thank you.
So this is just kind of an overview of what Jason talked about here with our recommendations. Establish the single regulated private distributor, have them supply the private retailers in the province, position them to work with Saskatchewan producers to develop the local production market, establish infrastructure through testing and other things that are going to facilitate that for producers and facilitate out-of-province export if at some point the regulations and laws change around that. There are some concerns importing and exporting out of country. There's going to run into treaty problems and other things that some countries have been working on. The one thing about this market is that it will evolve over time, and the recommendations that we've tried to come up with are going to put Saskatchewan in a position to best adapt to those changes. And when we look to places like Colorado and states, one of the big takeaways from that is expect the unexpected, that they were caught off guard thinking that they had everything planned out.
So just in summary, it's really important that we all remember what our starting point is for this analysis and the effective regulation of the cannabis market. And our starting point is a well-established and entrenched illicit market that is working quite well in terms of delivering product. This is going to put really severe constraints on what we can do as regulators and what we can do to compete with that market and do it effectively. So if we don't compete effectively, if we don't displace the illicit market, none of the other benefits that we've talked about in terms of public safety or health or regulating demand or any of these other things can flow, because the illicit market is already providing this product to youth, to anybody who wants it. So that's where we're starting from, and that's what we have to compete against, right? We're not going to displace the illicit market quickly. People are going to take time to change who they buy from, where they buy. They're going to take time to change the strands or varieties they buy. They're going to take time to switch their behavior. Behavior of this sort changes slowly. So this is not going to be an immediate transition from illicit to legal market on July 1. This is going to be a slow process, right? And we've got to make sure that we have regulation, policy, and market forces all working together to meet these objectives. Because if we don't get everybody pulling in the same direction, we're not going to get there. So just very quickly, some acknowledgements, really quick. Drummond Group provided the funding for this project. Thank you very much. It wouldn't have happened without you. The writing, Anne Ballantyne and Trent Blasey, wonderful. Thank you very much. Caught a lot of my mistakes. Research assistance from Sherry Millington and Angèle Poirier. were absolutely phenomenal. And the editorial and design from Erica Schindel, Dina Miller Design, and Editing Press. Last but not least, there's a policy brief that serves as an executive summary, and the full report are now available on the Johnson Shoyama website under the heading Research.